So there was a situation today where somebody who had recently traveled to a country where there are still some active cases of Ebola infection had been returned to U.S., to the state of Alabama, and was undergoing routine monitoring, which is what we do. We check their temperatures twice a day, and we monitor them for symptoms. And this person did actually develop some symptoms today and actually called us right away. We have some preparations and drills for this, and so we notified the appropriate agencies to have this person evaluated, and they're currently under evaluation right now to find out, what they have. Very often they may have something else, another disease, could be malaria or hepatitis or gastroenteritis, so many other things, but he's currently undergoing the appropriate tests now. Possible, but low risk. This person would fit under a low risk category, meaning that they did not have any contact with known Ebola cases while over there. They didn't participate in any high risk activities such as burial ceremonies or healthcare work. They would be considered a low risk person.
When will you have a better idea of what you're dealing with?
The tests are actually ongoing now, so we'll be doing tests for other conditions as well as doing an Ebola test. That information will start to come out tonight and tomorrow. We'll have the Ebola test done by tomorrow, the initial one, but there always has to be a follow-up test done, even if it's negative.
Was this individual a healthcare worker?
No.
Was he there for humanitarian reasons? Or?
I don't really want to say personal things about the individual to protect their privacy, but they were visiting the country.
Is that ER shut down right now?
Say again?
No.
ER?
No, it isn't.
Okay. We heard that there was some firefighters possibly they're being quarantined or something like that. Is that accurate? That came to that person's house today?
I have to ask the fire department that.
Yeah, I would defer that to the...
Somebody else is being quarantined.
Right. Yeah, I would defer that to the fire department. Yeah.
Is anybody in the hospital, any hospital employees at risk?
Because everyone was notified ahead of time and everyone put on appropriate precautions, PPE, personal protective equipment, in doing any direct contact or handling with the patient, nobody's at direct risk.
And we understand
have a
that.
large group of employees that have been training for over a year for this event. We were prepared. The patient is in the hospital being taken care of by our hospital personnel, and they're safe.
We understand the CDC is on their way here now. Is that correct?
I am not aware that that's true.
Yeah,
No,
I haven't heard that either. Yeah, typically what we do is we at the county level communicate with the state health department. The state is aware, and we've been in communication with, obtaining samples and doing the appropriate tests. Once the state is involved, if they feel it's necessary, they'll contact the CDC. The CDC will be notified of this, but I'm not aware of anyone from there coming right now.
And back in October, I remember we had a lot of conversations and a lot of press conferences about Ebola in the United States and in the Birmingham area. Can you speak more to that early level of preparedness leading up to today?
Well, I think during those earlier months that you mentioned, there were several cases of Ebola. There was a famous case in Texas that spread to some nurses. And then there were other healthcare workers that were working in West Africa who were flown back for treatment at various centers here in the United States. And many hospitals underwent preparation procedures during that time in case something like this should happen, just so that healthcare workers are protected, the public is protected. And so, as Anthony was saying, we followed through on a drill which we've gone through many times, and it actually went very well. Even the contacting of the patient to the first sign of any symptom to get them under evaluation before it could go on undetected longer.
Dr. Hahn, what is your title again? I'm sorry, I missed it.
Medical Director of Disease Control.
Jefferson County? Is that
Correct.
right?
Yeah.
And let me ask you this: you said that this patient was undergoing precautionary. I guess y'all were watching him.
Mm-hmm.
When did he first start, worrying that this was a situation or whatever?
Right. So everyone who comes from one of the countries where it has active Ebola cases, which there are 3 countries now, Guinea, Sierra Leone, and Liberia, anyone who travels from those countries to the U.S. is monitored for 21 days after arrival, check their temperature twice a day, assess them for symptoms, fever, headache, abdominal pain, body aches, nausea, vomiting, diarrhea. And if any of those symptoms start to develop while they're here in that first 21 days, which is the incubation period, then they're immediately taken in for evaluation.
And he just started exhibiting symptoms today, you said?
He had a, yeah.
You said the CDC has not been notified yet, but you're planning to notify them tomorrow.
The state has most likely this. I've been in touch with the state. I've talked to several people at the state tonight, and they're the ones that usually wind up talking to the CDC. So they may well have already talked to someone at CDC, but I don't know that for sure.
When you say state health department.
State Health Department in Montgomery, yeah, ADPH.
And what is their role in all this?
Well, they coordinate, with the local health department at the county level. They also have the lab there in Montgomery that can do an Ebola test. A confirmatory test is always sent to the CDC. And you may recall from the earlier coverage when this happened, first test may be negative, so you always have to repeat it in 3 days to confirm it's negative before totally clearing the person. So if this person's test is negative, they'll still need a repeat test in 3 days. But the state lab does it in Montgomery. CDC does a confirmatory backup test.
Are there any family members, neighbors in that area that are going to need to keep an eye out for themselves now the next few days, weeks?
From public health officials, we'll be in contact with them and take the necessary steps to keep them safe and keep others safe who may be around them. So,
Forgive me. Tell me again which country he traveled from.
just in the interest of the patient's privacy, I want to just say one of the countries. So. Mhm.
Do you think anybody else could be at risk? Just curious.
I think, like I said, even he is a very low risk. So if somebody's very low, and you may also recall from that earlier information, people don't tend to be infectious early on in the infection. So if you catch it on the first day, it's very unlikely that any transmissions occurred by that time. But we're always going to err on the safe side and check everybody.
And lastly, just so we don't confuse anybody, so this person he is a possible Ebola patient with a low risk. Is that how we refer to
Low risk, and the term they often use is a person under investigation. So he's being checked for not just for Ebola, but for the other much more common conditions that can occur in a returning traveler: malaria, typhoid, gastroenteritis, hepatitis, all those things that travelers get much more common than they do Ebola.
Right, and you might know this, better. Have there been other situations like this between, the fall and now at other hospitals in the country following these types of drills for patients exhibiting some risk of Ebola, or is this the first we've really heard in a long time?
Right. They've happened a few times here and there. I sometimes, they come on the news, and I see them mostly on internet news. But every once in a while, they get a brief Ebola scare, and and then they find out they have something else.
And it is a man, so they have gender.
I personally would just want to not say any personal information about the patient, so just out of respect for them. So.
Being kept right here and this building right here.
Yes, there's a specially demarcated area. Yeah.
Being well taken care of by our employees.
Awesome. Thank you.
Yeah, thank you.